And greetings, everyone. Thank you all for joining us this Thursday afternoon for our July training. We are excited to have you with us. I want to start by introducing myself. My name is Dr. Karan Phillips. I'm joined by my colleague, Megan Wolf, and we are here to share as much about how the public health sector can support older adult health and well-being. Just a general reminder today, as you join us, please keep yourself on mute. If you have questions during this session, please put them in the chat. We will be monitoring the chat so that the questions can be asked at the end of the session to our speakers, or speaker, I should say. As most of you know, Tifa, wrong slide. We will be continuing on with our post-survey training, post-training survey. So if you have not done this, we would invite you to please give us feedback on our survey, on our trainings. We do look at this information and use it to identify topics and sessions and how we organize, et cetera. So it will pop up once you exit out of the Zoom. So please share your thoughts and feedback. And for those of you that are new to us, TIFA is a public health policy research and advocacy organization dedicated to optimal health for every person and every individual. TIFA produces reports annually, including Ready or Not, which our 2024 report has come out. It focuses on emergency preparedness. We also have a report on pain in the nation, which looks at epidemics related to alcohol, drug, and substance misuse. That report actually is almost out, so be on the lookout for that in the very, very near future, the 2024 version of that. We also have some AFPHS-specific reports related to older adult in rural communities and aligning the 10 essential services with our AFPHS 6Cs framework. So for this year, we are focusing our trainings on different topics related to equity. We will show how equity intersects with other key topics and how they support healthy aging. And equity is at the center of our framework. If you have not already seen it, but it is at the core center of our framework. And we always highlight how that framework and that equity is central to supporting all older adults. And with that, today's training is focused on housing and the challenges and the considerations we need to make with housing older adults and some of the equitable considerations that we can make to address this housing challenges that exist. Today's speaker is Samara Scheckler with the Harvard Joint Center for Housing Studies. So with that, I will turn the virtual podium over to her.
So much, Dr. Phillips. I am looking forward to this conversation today. Today, we're going to talk a bit about a report that we've recently produced here at the Joint Center for Housing Studies. There's a link to the report on this site, or you can just kind of sit back and listen. So as baby boomers are on the verge of turning 80, we wrote this report to document the ways that these demographic changes are going to usher in a certain demand for home occupations for people who are seeking to age in a current place of living, as well as alternate housing options, especially in the communities where people are currently residing. We also expect rising demands for care, especially for the supports that people need to stay in their homes, such as home health aid assistance. A lot of people are going to need to purchase these services in addition to paying for their housing. So to us, the issue of care is a housing issue. And this is a report for us, and we think the field in our attempt to consider the costs of housing and care simultaneously together. The Housing and Aging Society, I'll say briefly, is a program within the Joint Center for Housing Studies here at Harvard. We formalize and build on research on housing and aging with a particular focus on equity and the experiences of vulnerable older adults. We're motivated to do this work because US households are aging and our household system is just not prepared. We're not ready for it. We'll open today with a glimpse at the increasing number of older adults in our communities. Between 2012 and 2022, the population of people aged 65 and older grew by 34%, from 43 to 58 million people. Over the same period, the share of households headed by an older adult increased from 22 to 27% of all households across the US. Looking ahead, the center projects that the number of households headed by a person age 80 or older is going to more than double between 2021 and 2040. It will reach nearly 17 million households. In addition to the strains on the health system recognized by many in this room, this growth in households 80 and older will usher in increased demand for affordable and accessible housing that's connected to services and supports. Because the vast majority of older adults live in the community in homes that they own or they rent. In 2021, 88% of older adults or their partners were the householder of their home. Of these, 80% lived alone or just with their spouse. Others lived in a place owned or rented by another. So just over 9 million lived in the home of another person, most typically their adult child. And 1.4 million people, which represents about 2.5% of the older population, lived in a group quarter of some kinds, like a nursing home. Importantly, more people lived alone at older ages, increasing from 25% of those from 65 to 79 to 41% of people 80 and older lived alone. And most living alone at these older ages are women. Okay, so now we're going to discuss the implications of these demographics by considering 4 topics. We'll start with housing affordability and wealth. We'll talk about housing accessibility, then housing adequacy and environmental hazards, and we'll finish with connections between housing and services. As we open the conversation about housing affordability and wealth, we'll have our first key takeaway, which is that the number of cost-burdened older adults has hit an all-time high, and disparities in wealth and income are on the rise. The overall median household income for older adults was $50,000 in 2022. Income falls with each successive older age group. So households 80 and older had an overall median income of just $37,000 compared to the overall median of $50,000. Over the past decade, income has grown for older households, but like for younger households, this growth was concentrated among those with the highest incomes. Between the lower median income at advanced ages and also this concentration of income growth at the top of the scale, that means that over the last 10 years, there's been a decline in inflation-adjusted income for people age 80 and older living with lower income. So even though there's been overall growth, people living with lower income, households at 80 and older with lower income have actually seen a decline over the last 10 years. So as more people reach their 80s, we expect to see more households falling behind, continuing to fall behind and live with low income. So we think this trend is going to continue exponentially. Older adults receive income from a variety of sources. In 2021, nearly 40% of all older households reported income from pensions and retirement accounts, but this income source was much less common for lower income households. Among households that made $75,000 at least, 54% had a pension or retirement income, compared with just 10% of households with incomes under $15,000. So this income source is much concentrated at the upper ends. 20% of older households reported income from wages and salaries, which aligns with the Bureau of Labor Statistics, which reports to us that 19% of adults 65 and older are still employed or in the labor force in 2022. While Social Security income, which is the purple bar, constituted a third of the income reported by all older households, it represents fully 74% of income for households that made $15,000 or less, while just representing 16% of income for households making $75,000 or more. So overall, lower income houses are much more dependent on public income subsidies, and they're going to be much more sensitive to changes in these programs and access to these programs. There are also income disparities by race and ethnicity. So Black and Hispanic households, shown here with the yellow and blue diagonal fill, have incomes that are less than 80% that of white older adults. This is true for both homeowners and for renters. Asian homeowners have the highest incomes of all older homeowners, but Asian renter income is 70% that of white older renters, that is the highest income group. We also want to consider wealth as we discuss older adult household resources, especially since older homeowners have a significant amount of home equity that's available to them. In 2022, the median home equity for older homeowners was $250,000. This is 47% increase from 2019, when the median was $170,000. So that equity number has gone up quite a bit over the last few years. In aggregate, older owners age 62 and older had more than $12.7 trillion in home equity in the second quarter of 2023. So it's tempting to consider recommending that we liquidate some of this wealth to finance late life needs. But there are deep disparities in the distribution of home equity. So lower income homeowners have less wealth overall, and more of their wealth is tied up in their homes. Owners in the lowest income quartile, people who own their home in the lowest income quartile, had a median home equity of $115,000. This represented 67%, or 2/3 of their total assets at median. On the other hand, owners in the highest income quartile had median equity of over $500,000, $562,000, which was just 21%, or only about a fifth of their median total household assets. So they were much less, the house was a much smaller part of their portfolio, even though the assets were much bigger. And renters were particularly worse off, with just 2% of the total wealth of all owners overall. Similarly, there are striking wealth disparities by race and ethnicity, with older Black and Hispanic households reporting less than half of the median net wealth of older white households in 2022. As noted, home ownership is a large component of older adult wealth, and at a rate of 79% in 2022, older adults are more likely than other age groups to own their own home. But you can see in this graph that falling ownership rates for 50 to 64-year-olds, seen in the darker bars on the chart, suggest that there is change on the horizon, and we do expect lower home ownership rates of older adults in the future. Additionally, older owners are carrying more debt. This includes vehicles, student loans, and credit cards, but there have also been dramatic increases in older homeowner mortgage debt over the last 30 years. So between 1989 and 2022, the share of homeowners aged 65 to 79 who have a mortgage on their primary home increased from 24% to 41%, with a 400% increase in the median debt amount, the amount that they're carrying. This growth was even steeper for owners that were 80 and older. The share of these oldest owners who carry mortgage debt increased tenfold. So we really are seeing these older owners relying on their housing equity much more. Additionally, their median mortgage debt amount shot up over 750% from $9,000 to $79,000, both adjusted to 2022 dollars. So many more older homeowners are carrying debt, and their debt loads are much longer. At last measure, older Black owners were the most likely to carry mortgage debt at 50% compared to 39% of older white owners. Overall, we want to think about this with some concern because overall housing debt does correlate with financial strain. Older owners who have mortgages have higher median monthly housing costs than renters or older owners who don't have any mortgage debt any longer, and many do have a hard time paying these costs. Worryingly, over 11 million older adult households were housing cost burdened in 2021. This means that they paid 30% or more of their income for their housing. This is an all-time high in numbers, although the share at about a third of cost burdened households has remained fairly steady over years. More than half of these households were severely cost burdened, which means that they were paying 50% of their income for housing or more. Cost burdens are more likely to affect older households that have lower incomes, also renters and owners who carry a mortgage. In addition, cost burdens are more likely to happen for older adults of color and older adults, households 80 and over. By race and ethnicity, 44% of older Black households and 43% of older Hispanic households have housing cost burdens compared to, remember, the share of a third overall. Roughly 24% of both populations have severe burdens. 38% of older Asian and 36% of multiracial and other race and ethnicity households are also cost burdens. Cost burden rates do also vary by geography. So on the landing page for the report, we have an interactive that shows how cost burdens differ. You can change around the geography for being owners, without owners, for renters, and also by age. More than half of older renters experienced housing cost burdens in 2021, including 73% of renters earning $25,000 per year. And over a quarter of older owners were housing cost burdened in 2021. This included older owners that own their homes free and clear, 17% or 2.8 million of whom were still housing cost burdened. So just because they didn't have housing debt doesn't mean that all of their housing costs were affordable to them. Also, older owners who were still paying a mortgage, 43% of owners with housing debt were cost burdened. More than 3/4 of older owners with a mortgage and an income under $25,000 did experience some housing cost burden. Worry about housing cost burden because of other problems that it can create for older adults. When households are not able to afford their housing, we worry there may be spillover effects into other costs of living, including their out-of-pocket healthcare costs. One project we completed a couple of years ago showed that 50 to 64-year-olds increased their spending on out-of-pocket pharmaceuticals after they finished paying off their mortgage. This suggested that their housing payments may have been unaffordable and forced them to make trade-offs and ration the medications that they were purchasing. Notably, the effect disappeared for households 65 and older, suggesting that it's helpful to have Medicare subsidies which lower healthcare costs than those 50 to 64-year-olds, many of whom were on private market plans. In extreme cases, unaffordable housing can lead to housing insecurity and homelessness, which is a significant risk to older adult health, and it has been on the rise for older adults. In addition, an additional 10,000 people, 65 and older, experienced sheltered homelessness between 2019 and 2021, topping 60,000 people nationwide. This increase has been related to the aging of the younger baby boomer cohort that has had a history of economic hardship. Additionally, some housing pressures compound with age. This includes the loss of key family supports, difficulty of managing increased housing costs on a fixed income, and the challenges finding accessible housing options as disabilities arise. A recent study in California found that among single adults experiencing later life homelessness, 41% had become unhoused for the first time at age 50 or older. Homelessness is especially dangerous for older adults and those with chronic health conditions, with serious implications for mortality. This chart reflects an analysis that we conducted of Massachusetts Homeless Management Information System data. Older unhoused people in the purple bars reported much poorer health than younger cohorts. Federal rental assistance is vital to the housing stability of many older adults, but housing subsidies are not an entitlement. In 2021, just 36.5% of older households who were income eligible for a housing subsidy actually received it. So in other words, you can qualify for the subsidy, but you are relatively unlikely to actually receive that subsidy. So this left 2.3 million older renters with worst case housing needs, shown here as severe problems, which include paying more than half of their income for housing, living in severely inadequate conditions, or both. This is an increase from 1.5 million in 2011. There's a lot of room to improve affordability by increasing the size of existing programs. If income supplements were better aligned with actual local cost of living, fewer older renters would find themselves priced out of communities that have excellent transportation infrastructure, services, and medical care access. Additionally, research suggests that shallow subsidies, which are small payments that either cover housing for a few months or offer a small regular monthly assistance amount, can dramatically improve housing stability for residents who live on the economic margin. However, we will not meet the affordability challenge until we expand housing subsidies to meet demand that exists for them. So all qualified applicants need to have access to the assistance, the housing assistance that they need. This means that we need more units of affordable housing, and we have to focus on both production and preservation of affordable housing. The next key takeaway that we'll discuss is that most of the US housing stock needs modification to accommodate residents who have limited mobility. Functional difficulties increase with age. This includes challenges with mobility, hearing, vision, cognition, self-care, and also independent living. 37% of people age 80 and older reported an ambulatory difficulty, such as walking or climbing stairs in 2021. On average, functional difficulties like this are experienced earlier for older adults with lower incomes and for people of color, so they may be living with these challenges longer. Accessible housing can help people with mobility difficulties live with more independence, but under 4% of housing actually offers 3 key features, including a no-step entry, a bedroom and bathroom on the entry floor, and also extra wide hallways and doors to accommodate the turning radius needed for a mobility device like a wheelchair. As of 2019, only around half of older adults occupied a house with single floor living and a no-step entry. This means that many older residents need to modify their homes to improve the accessibility of their house, but these modifications can be extremely expensive. Further, a large share of older owners live in homes that were built before 1980. These are shown in the brown, orange, and red bars on the chart. This means that older adult households have higher costs for maintenance, repairs, and replacements as the components of their houses age out, and there's less housing budget available to make modifications and meet emerging needs. The household budget is also increasingly strained by climate-related hazards. While insurance rates are rising nationwide, so this strains the household budget, there are specific threats that differ by geography. So depending on location, residents increasingly have to update their homes to protect against extreme heat, floods, fire risk, high winds, or also the poor air quality related to problems like floods or fires. This map, for instance, shows that houses in some regions of the country are much less likely to have air conditioning, and air conditioning, it will be just extremely untenable for older residents to live without air conditioning as heat waves become increasingly common nationwide. These climate and weather hazards just continue further chip away money available for accessibility modifications to make the home livable as but physical needs change. So we worry about a misalignment between the home and the resident of the home. When the older adult resident's needs are out of line with the features of the home, it can become difficult for them to enter their home or to use the home. And the rates of these problems do increase exponentially with age. Such misalignments between the home and the resident create fall risks, and they can increase reliance on supportive services. So for instance, a resident might need help with laundry if the units are in a basement and inaccessible to them, but moving the laundry to the main floor, they may be able to independently do that housekeeping chore themselves. Unfortunately, older adults of color begin to experience physical difficulties at younger ages, as we discussed, and they also report disproportionately high rates of difficulty entering or navigating the home. So when we're thinking about accessibility problems, we should particularly worry about the housing stability of people who are Black or Hispanic, especially if they're living alone. This said, there are excellent examples of home modification grant and loan programs that could be taken to scale to meet emerging needs. For instance, HUD's new Adult Home Modification Program offers grants of up to $5,000 to improve the accessibility of the home for low-income residents. There is a program here in Massachusetts called the Home Loan Modification Program, which subsidizes loans up to $50,000. So homeowners can accomplish larger modifications and do so even if they're living at middle income levels. However, the scope and reach of these programs needs to expand a lot. We're watching a promising innovation as some Medicare Advantage programs have begun to cover ramps, lifts, and grab bars as durable medical equipment. Full Medicare coverage for these features would change the landscape and improve access significantly. Further, building housing with accessible and adaptable features will generally create a more accessible housing stock and increase the housing options available to older and to disabled residents. Finally, let's talk about older adults and their likelihood at some point to need access to services and to supports. Nearly 70% of people will need long-term care services and supports at some point in their lives, and many are going to live alone when these needs arise. Families are increasingly limited in their ability to help as baby boomers had fewer children, and many of these children work full-time in the workforce, especially the adult daughters who have been traditional caregivers in the past. In our analysis of health and retirement study data from 2010 to 2018, we found that nearly 30% of people 75 and older living alone needed help with at least one activity of daily living. This includes dressing, bathing, using the bathroom, eating, or getting up from a chair. But less than 25% actually received any assistance in this area. So this suggests that there are many older adults who live alone with very basic unmet daily needs. Medicare does not cover long-term care services, and Medicaid, which pays for 44% of the professional services that are currently provided, operates long waiting lists for home-based care in most states. Last year, only 7% of care was covered by private health or long-term care insurance. So many older adults have to pay the high cost of care in addition to housing. 14% of long-term care services were paid out of pocket in 2021, according to the Congressional Research Service. But this cost of care at home or in assisted living is out of reach for most households. The median price for a home health aide was $27 an hour in 2021. Care must typically be purchased in 4-hour blocks. This means that the cost is more than $40,000 a year for a daily home health aide visit, and that's on top of paying for the housing in which the care occurs. The median annual cost of assisted living, which is a model that combines room, board, and a basic amount of care, is around $63,000, though in some places rates are much higher, closer to $98,000. To dig into this a little bit more, we studied 97 metros and found that only 14% of adults 75 and older who were living alone were able to afford a daily visit from a home health aide on top of their other living and housing costs. Just 13% were able to afford to move into an assisted living. Local costs of housing help determine whether care in an assisted living or care at home was a better economic value. So across these 97 metros that we looked at, price differences between the two models were biggest in Ogden, Utah, where $54,000 for assisted living was especially more affordable than care at home. And in Bridgeport, Connecticut, which was the opposite, where $71,000 for in-home care was the lower cost option. There's also an interactive on our website that lets you compare the costs of care between these two long-term care service models in the different metros we studied. As seen in the blue wedges of these pies, older people living alone do have more trouble paying for care after their housing and living costs are paid. This is particularly concerning for people who live with a disability. Of older adults who reported a difficulty with mobility, a difficulty with self-care, independent living, or memory, cognition, or vision, or hearing, just 11% who lived alone were able to afford a daily visit, as compared to 34% of those who had one of these difficulties but lived with a partner. Older renters are also much likely to be able to afford care at home, though with the high number of older homeowners, there are total and some more older owners overall who are unable to meet these daily costs of housing and care. Finally, we see very concerning differences in care affordability by race and ethnicity. Black and Hispanic households are much less likely to be able to pay for daily care at home on top of their housing and their living costs. These two groups are also more likely to live in multi-generational households, which are arrangements that may be used to meet their long-term care needs. However, family members do not always have the capacity to meet these needs, both in terms of training and in terms of time. And these caregiving responsibilities can strain family resources and their economic security intergenerationally. While we called earlier for better access to housing subsidies for those who qualified, for those who were under 50% AMI, we also need to note that some older adults who are unable to afford cost of care also make too much money to qualify for those housing subsidies. As I said, typically set around 50% of area median income. We called these households the GAPS group, or the group between affordability and public subsidy. And we took a close look at these moderate income residents who were at least 75 years old, chosen because we thought they were more likely to need assistance, who lived alone, and who were unable to afford the median local cost of assisted living, where cost of living and care are bundled in the 97 metros that we had cost data. This chart shows that the income range of this GAPS group varied widely from a low of $18,700 in Memphis, Tennessee, to a high of $107,000 in Bridgeport, Connecticut. So in other words, a person living alone at 75 in Bridgeport, Connecticut, cannot afford to meet their need for daily care and assistance. Most GAPS households could be described as middle income according to the Pew Research definition. And in fact, of all middle income people 75 and older living alone in 2021, 69% fell into this affordability gap. So this is very much a middle income problem. This GAPS framework emphasizes that affordability is driven by a combination of income and care costs. So on average, GAPS households had only 62% of the income they would need to afford the median assisted living base rates in their region. Places with lower assisted living prices were not necessarily more affordable, given that those places also had lower median incomes for older adults. We've talked about the ways that subsidizing the housing costs of all older adults who qualify could reduce the housing cost burden and improve housing stability, but affordable housing can also help older residents access the care and assistance they need. Housing vouchers can enable older renters to move closer to family or to the services they need. And service-enriched housing, such as provided by many Section 202 properties, often includes service coordination or other partnerships that connect the older residents to community resources that they need. So affordable housing can increase stability across multiple dimensions. Given our work on middle income care affordability, we would add that expanding housing subsidies to assist moderate income older households who typically earn 50 to 80% of area median income could help shore up this vulnerable group. But even more foundationally, the cost of care needs to be addressed by expanding access to Medicaid-funded home and community-based support programs, which in many states only assist a small fraction of the older adults who qualify for them. For instance, in Indiana, there's a 5-year waiting list for these services with an estimated 13,000 individuals on the list. 5 years is a long time to wait for someone to help you use the bathroom. Innovations to bridge housing and care look like programs such as PACE, the Program of All-Inclusive Care for the Elderly, in which one interdisciplinary team receives funding to provide services that meet all of a client's health needs. PACE teams can choose to coordinate services, provide equipment, they can use the money to improve accessibility, and even provide companionship if they decide those supports might reduce expensive hospital and nursing home stays. This whole person approach can reduce the health and housing system divide and reduce fragmentation of services. In some states, like Massachusetts, PACE programs partner informally or formally with local housing authorities to meet the needs of older residents as those needs evolve. There are also organizations such as Silvernest and Nesterly that help match older adults to roommates who can help reduce their housing costs, their cost of living. In some cases, they match younger housemates who agree to provide some amount of support and assistance in exchange for more affordably priced rent. And surveys of these models have shown that older adults who receive these matches find the care and assistance and companionship even more valuable. They rate it more valuable even than the economic subsidy that the roommate provides. Even with these innovations, though, many older adults will receive support from family members, and some will choose to co-reside with their family. Housing design needs to adjust to accommodate non-nuclear families, and subsidized housing systems need to ensure that rules are flexible enough to allow changes in the family unit and let family leave and other employment policies are also going to need to adjust to facilitate family caregiving. So we've discussed a lot of challenges as we stand on the cusp of these demographic changes, but there are also a lot of opportunities to rise to these challenges and to construct a housing and services system that is more affordable and more accessible, that's better connected to the health system and the long-term care system. By approaching the coming decades proactively, thoughtfully, we can meet the needs of the baby boomers by ushering in a more efficient and more effective, more coordinated, and more compassionate housing, health, and long-term care services system. I appreciate your attention to these critical issues and the work that you do for the health of older adults who live in your communities, and I look forward to the rest of our conversation.
Thank you so much, Samara. We've got a couple of slides that we also wanted to share, just with some possible recommendations, some things to think about that are aligned with our 6Cs framework. We always like to put everything in the context of our framework. So, Kron, if you could go to the next slide, and I'll just briefly run through these, but I appreciate the resources that you all are sharing, and then the questions that you have too in the chat, because of course, the information that we have is certainly not exhaustive. What Samara has laid out is so important for us to consider. And we also want to think about, like, what are those solutions? What are those public health actions? So in terms of thinking about our framework, we know that adoption of a healthy aging in all policies approach means that we're thinking about older people and we're applying a healthy aging lens across a community and across all the services and programs that older adults need. In terms of connecting and convening partners, we want to think about what are all the, if we want to plan for, as Samara said, we're on the cusp of this demographic shift. It's happening. One of the things that we can do is think about planning for the future. So who needs to be on that planning team? Your aging services, of course, but thinking about those people who are addressing and monitoring homelessness. This is a huge issue and one that's not going to go away anytime soon. So we need to think about that. And then, of course, our community planners and builders, and thinking about who in our community is responsible for making the zoning decisions. Those are all important as we think about. I know where I live in Northern Virginia, I've been looking for a single family home for a long time that's affordable, and we just haven't been able to find one. Of course, housing costs are going up everywhere, but we need more single family homes. Not single family, sorry, one level homes is what I meant to say. In terms of coordinating existing supports, what public health can do is, as you become aware of the different services, including home assessment, fall risk assessment, home modification services, and some have been placed in the chat today, create a hub on your website that includes all those services. Expand data collection efforts to focus on the disparities in access to affordable housing. And then as you're creating this information and creating these hubs, think about how to communicate that out to the community and to create and share decision support tools. So in Samara's presentation, I thought it was so interesting. I've never seen that before, the comparison of the cost of in-home care versus moving to a facility and what those costs are. No, in my community, it's very expensive to move into assisted living. But figuring out how to help people make those decisions, I think, is really important. And then sharing, again, information about rental assistance and affordable housing communities, all the different options for housing in our brief, that I included a link to our housing brief in the chat. we provide some information about that kind of multi-generational home sharing and some of those opportunities that exist in communities around the country. So in thinking about these opportunities, Samara, I don't know if you had any additional thoughts about some of these recommendations or frameworks, but we'd also like to hear from others who may have other suggestions of programs that they have in their communities or that they're aware of. So let's take down the slides at this point, Karan, and we can just have conversations. But first, Samara, any additional thoughts about some of those recommendations or any of the things that folks have shared?
Yeah, I appreciate all the context, and I was enjoying looking through some of the comments that folks made about the local programs and resources. I think one of the things that's so complicated about anyone who's working with the older adult population, whether it's from a healthcare perspective or a housing perspective or really any formal interaction, is that so many of these systems are relatively siloed, right? So understanding what the connections into, the aging services system in your area, your local AAA, for example, looks like, so you can make those referrals, and knowing what the connection to the housing system, into the affordable housing systems in your area look like, I think are extremely valuable. Some places also have innovative programs. For example, in Massachusetts, there are programs that help people who are facing evictions and who experience disabilities, and those people get special protections in court, and understanding really just what your state and locality, what kind of protections they offer to older adults and people with disabilities, I think is just, you can become an invaluable resource, or even if you just have a couple good names to send people along to, because again, these systems are so often so siloed.
Yes, they are. And I think that is there is an opportunity, I believe, in states that are developing multi-sector plans for aging. Housing agencies are very often part of these conversations, but they're not always. So for those states that are developing those plans, I think it's important to make sure that your housing agencies are at the table. Beverly, you had a question. I don't know if you want to come off mute and ask your question. That would be great. Oh, first, I'm sorry. Let me go to Margaret first. Margaret, you want to come off mute and ask your question?
Sure, thanks very much. I wonder if there's any information that is specific to rural areas, because rural areas are just so challenging. The distances are greater, the housing stock is older, people don't want to leave their rural communities and move to a place where they don't know anybody else. So is there we're always looking for answers, right? So is there any information that can help to inform those who are working with rural areas?
It's such a good question, and you're right, it is such a difficult problem. It's not a problem that people live in rural areas. It's a problem that people in rural areas have such lower access to services and supports. And you're absolutely right that that there's less information, also because it's harder to study these areas, because they are more diverse, just more diffuse, and the data itself just isn't as good. Some of the innovations that we've seen tend to come from the agencies that are working in these areas, performing multiple functions and getting funded accordingly. So even if there are not multiple, even if the choices are fewer, hopefully there are organizations that may be performing, that have more capacity, that maybe don't refer out, but are able to accomplish more of the needs. So for example, maybe the AAA doesn't refer out the transportation and meal services, but is able to provide them in-house because they, but the distances and the lower density really do make service is challenging, especially when people are living alone and aging.
Yeah, it's a tough one. Thanks, Margaret. I'll say, Beverly, you had a question about the cost. Where can you find more information about the pricing? So could you clarify whether you're thinking about the price of assisted living or the price of actual housing? What can you clarify your question a little bit?
Yes, sorry that I missed the first part of the video. We had another video from the state that was mandatory, so I was on the late, so you may have already covered that. But on our CHIP plan, our community health improvement plan, my task on that plan is to resource housing and housing costs. And it's due by December. So I would like to include the senior cost and what that entails. So, like I want it to be more on a more professional level than what I have it now. So I just need a resource of where I can go to, perhaps, that I can share what was shared today, that information with our community.
Yeah, I mean, I will certainly, I'll link it in just a second. I'll link our report in here, I'll put it right now in the chat. And there's a lot of national level data in there that kind of breaks down the housing experience. But I certainly encourage you to think about some of the separate groups, because the main costs do differ, whether you're thinking about older adults who own their home free and clear, but maybe are lower income and can't afford to maintain them, and their housing asset is declining, or it's no longer accessible to them, or they can't afford to heat or cool it, or there are climate related issues that are making their house unsafe, or insurance is skyrocketing, and because they own their home free and clear, they drop their insurance and put themselves at high risk of losing their housing asset and their housing in the process. So just because someone owns their home doesn't mean they're necessarily in a good position, and secure, whereas older renters are subject to market rates, and that is really challenging for people who are living on a fixed income when their income is not necessarily tapped to the market in the same way, and especially with the very low access to rental subsidies that can be really, really difficult for older renters.
And I think, Beverly, in Florida, I think your costs are different than other parts of the country too. So there are a lot of variables that we have to think about. So we can try and think about too, connecting you with some additional resources.
Thank you.
Other comments? Here's a question. Is there a resource detailing, sorry, I just missed it. State housing authorities partnering with PACE or other support service entities? I'm not sure about that. Yeah, I don't know.
So it's a good question about resources. I'm not sure. I'm not thinking of like a particular website, but I do know that here in Massachusetts, those partnerships are emphasized, and I would be happy to connect someone to our Department of Aging that is doing that work, and they very much have a vision of PACE floor, programs either taking over floors in affordable housing or serving residents as they age into need for that kind of support and assistance. So the partnership exists, but I'm not sure that I can help with a kind of website that talks about. There may be something out there if we Google it a little bit, but
Thank you. Good questions. And then I'm not sure how to pronounce your name. Is it Carol or Krell? You talked about, or you put a comment in about a tiny house community with a garden as a centerpiece. I love that idea. Can you talk about that a little bit more?
Sure, it's pronounced Carol.
Carol.
And howdy
Okay.
from Texas to all of y'all. This is an idea I had a couple months ago, actually probably by now a year ago. I thought about, I proposed this idea about having tiny houses and then have the residents tend the garden, and they wouldn't have to pay for anything. The houses would be designed so that you would have a Murphy bed. You could raise automatically, or if there was a power outage, you could manually lift it back up. The dining table would be a Murphy table, and it would be a good size. But they would tend to the garden, and they would get their food from food sources from there. We also partner. I work for the Wichita Falls, Wichita County Public Health District, and we partner with Meals on Wheels. So if they needed sustenance, they could have more than just what's in the garden. We also have a teaching kitchen here. So if it was in our area, they could come in here and learn how to prepare food. So, and there would be some rules to it, but but I thought that would be a nice idea. And there's no rent for at least a year.
Wow.
And so they could kind of get on their feet. So that's kind of what I'm
Yeah.
tossing around. And we'd have to deal with we are a city department. So we'd have to talk to the legal department, but I thought it was a good way to give somebody a lift up, a hand up. So
Yeah, I love that idea. That's great.
thank you.
Thank you for sharing. Well, thank you, Samara. Such a great conversation. And yeah, Margaret, thank you. The National PACE Association, Leading Age, all really good resources. So we'll collect the resources from the chat and share these out along with the slide deck and a link to the recording afterward. But really appreciate all the great questions and the wonderful information shared here today. And I'm going to turn back to Karan to close us out today.
Thank you, everyone. I think some of you know housing is near and dear to me, as I used to work in affordable housing, so I thoroughly enjoyed the conversation. Just to close us out, our next session will be, or training, will be August 15th at 3 p.m. Eastern Standard Time. It will be available for registration under events very soon, so always check that out. And this recording will also be posted under events as well. The slides, and as Megan mentioned, along with the links that you all have been sharing, will be shared out probably on Monday of next week. And for those of you that are pursuing becoming an AFPHS champion, I would invite you to pause the training right now to navigate using the QR code or type in the URL listed on the screen to indicate that you attended this training. And if you are viewing this as a recording, please pause and again, mark that you attended this training so that we can mark your attendance to becoming a champion. And again, that's for people that attend or view 6 of our trainings. So we have over 100, we're on our way to 120. We want, everyone in the world to become a champion, but we'll start small. And thank you everyone for attending today.